Thank you, Mr. President, very much. I'd like to start my remarks on the Comprehensive Abuse and Recovery Act today just by complimenting all of the members, Senator Whitehouse, Senator Grassley, Senator Portman, Senator Ott, Senator Shaheen, all the members who have been working so hard on this legislation to produce something which is very much needed by our country. And I'd like to begin by just telling a little story of a constituent who wants to remain anonymous, and this is her story. It's that on July 20th, 2009, that she said that she was a passenger in a vehicle with her close friend at the time behind the wheel. The light turned green, and as expected, he hit the gas. But he was hitting the gas. The oncoming car never hit their brakes to stop at the end of a red light that they were approaching. She says, "I was painfully pinned in the passenger seat. All I could hear was my friend asking me if I was okay. Upon arriving in the ER, I was quickly poked, prodded, and injected with high-level painkillers. This is where it all began." Walking out of the hospital, I wasn't only walking out with crutches, but a prescription that changed the next 5 years of my life. I was prescribed OxyContin to help manage the pain I was experiencing. With continuing follow-up appointments and check-ins, also came more prescriptions for pain management prescriptions. 2 months after getting into a car accident, I was a heroin addict. How quickly all things I knew changed. In September of 2009, I not only began shooting heroin, but I also began my first semester of college. I was a freshman at UMass Boston. Worked full-time, but secretly, I was also a heroin addict. I kept my addiction a secret from everyone I knew, including my close friends and family. On August 31st, 2014, I woke up and said to myself, enough is enough. I took 3 overdoses in order to open my eyes. Since leaving treatment in November of 2014, my recovery has not stopped. I continue to learn and to grow daily. I have also learned of the medical issues and complications that my heroin use has led to. I now suffer from seizures because the excessive drug use over 5 years has led to minor brain damage. Along with the seizures, I have tested positive for hepatitis C and HIV, which is common with injection drug users. At the end of the day, all I want to do is to help others who are struggling because I know what they are going through. Well, she is one of the fortunate ones. She found the help that she needed and had the strength and support to get clean. But I'm hearing enormous frustration from people who don't feel that sufficient resources are being brought to bear on this enormous epidemic of prescription drug and heroin addiction. All week, we've heard the statistics here in this chamber. Our nation is experiencing more deaths from drug overdoses than from gun violence or auto accidents. 80% of the people suffering from heroin addiction started with opioid pain medications approved by the FDA and prescribed by doctors. 27,000 people died from an opioid overdose in 2014. 1,300 of those came from the state of Massachusetts. So this issue is one that doesn't just affect the Bay State. America is drowning in a tsunami of heroin and prescription drug addiction that we must stop before it drowns any more families and communities. Now, let's compare what we did as a nation when confronted with other deadly epidemics. A bipartisan majority in Congress funded more than $5 billion to respond to Ebola. We dispatched the medical community and public health experts. Today, the Obama administration is asking Congress for $1.8 billion in emergency funding to fight the Zika virus. Imagine if we applied the same commitment, the same urgency, and the same level of resources to the prescription drug and heroin epidemic. We need an immediate and comprehensive strategy that requires commitment from all levels of government, state, local, federal, and that means Congress must step up and respond with leadership and with resources. We need to stop the overprescription of opioid pain medication. We must prevent addiction before it takes hold, and we must provide the funding necessary to ensure that we stem this tide of deadly addiction. The Food and Drug Administration must change its decision not to seek expert advice about the risks of addiction before it approves abuse-deterrent opioids. Abuse-deterrent opioid is a contradiction in terms. Whether an opioid is abuse-deterrent or not hasn't prevented tens of thousands of people who have had their wisdom teeth removed or experienced lower back pain from getting addicted to these painkillers. By refusing to convene advisory committees to inform all of its opioid approval decisions, the FDA continues to ignore outside experts who could help stem the tide of tragic deaths and overdoses plaguing this country. That's why I have filed an amendment to require the FDA to convene advisory committees of outside experts for all opioid approval decisions, period. Now is the time to implement effective and common-sense solutions, but we need funding to do that. Funding for families, funding for treatment providers, funding for our sheriffs and our firefighters who carry the overdose prevention drugs that save lives. We need to provide the real resources necessary to address a crisis that is only growing in numbers and severity, and that comes in the form of emergency funding. We are hemorrhaging lives by the day, and supplemental funding is the first step needed to staunch the flow of suffering and death. Ladies and gentlemen, we are at a watershed moment in this national debate to address the public health crisis of addiction. So let's be clear. Stopping the overprescription of pain medication that is fueling opioid addiction and overdoses starts with the prescribers. We need to require anyone who prescribes opioid pain medication and other controlled substances to undergo mandatory training on safe prescribing practices and the identification of possible substance use disorders. That's why I have filed an amendment that requires prescribers to get the education needed to help staunch this flow of suffering and death. The doctors will say that they don't want education to be mandated, that it should be voluntary. Well, the FDA has had voluntary education for opioid prescribers in place since 2013 and has been actively encouraging doctors to take these voluntary education modules. But in more than 2 years, less than 12% of prescribers have actually completed FDA's voluntary education program. A survey of 1,000 physicians nationwide found that nearly one-half of doctors erroneously reported that abuse-deterrent formulations were less addictive than their counterparts. It's unconscionable that our doctors know so little about these potentially deadly painkillers. And I intend to call up Amendment number 3382 later so that we can make consideration of the bill. The amendment would ensure that as a condition of receiving a license to prescribe opioids, that the recipient of the license is educated in the best practices for using opioids and the connection with addiction and with diversion. And I intend to call up that amendment later, asking for consideration. So from my perspective, if we're going to have a real strategy, then we have to make sure that there is a requirement that there is continuing education. We also need to remove the barriers to effective treatment, including outdated federal restrictions on medication-assisted therapies like Suboxone. Medication-assisted therapy for opioid addiction is cost-effective, it decreases overdose deaths, and it reduces transmission of HIV and hepatitis C. That's why I have filed an amendment that would lift the caps that are limiting the number of patients doctors can treat with medication-assisted therapies. If we're going to reduce the supply of heroin and illicit prescription drugs, we have to reduce the demand through effective treatment. I've been working with Senator Paul from Kentucky on that amendment. Also, fear of a lawsuit should not deter anyone from trying to save the life of someone suffering from an overdose. That's why I have filed an amendment that creates a federal Good Samaritan provision to shield from civil liability family members, friends, and other bystanders who administer opioid overdose prevention treatments like Narcan. The debate that we are having on this legislation this week is just the beginning. We must let prescribers know that unless they get basic education in opioids, they will have to turn off the spigot of painkillers that are flooding this country and leading to deadly overdoses. We must let law enforcement and the judicial system know that we cannot incarcerate our way out of this problem. And we must let Big Pharma know that we are going to work to ensure that we have a lifting of awareness of this issue every single day. Enough is enough in this country. Enough is enough. We've just seen an explosion here in terms of this problem. We must now let all those struggling with addiction know that help is on the way, and that no matter how dark life seems right now, that there is hope and sunlight will grace them once again. I thank you, Madam President, for giving me the opportunity to speak at this time, and I yield back the balance of my time.